Jersey.
I didn't hear that, Mr. President.
The senator from New Jersey.
Thank you very much, Mr. President. I appreciate that. I appreciate your kindness and the respect with which you give the great Garden State. Mr. President, I would like to talk a bit and then ask for unanimous consent on the South Asian Heart Health Awareness and Research Act. I'm really proud of this work in a bipartisan effort. In general, heart disease is widely prevalent. It's an alarming statistic that I want to reveal to everyone, that every 36 seconds, a person in the United States dies of cardiovascular disease. This is a national crisis. But when you break down the data by racial and ethnic group, it is the South Asian Americans who have the highest death rate from heart disease. Almost 2/3 of middle-aged South Asian Americans are at intermediate or high risk for heart failure within the next 10 years. Compared to the general population, South Asians are 4 times more likely to have heart disease and have a much greater chance of having a heart attack before the age of 50. The prevalence of type 2 diabetes, a leading cause of heart disease, is the highest in America amongst South Asians. Some of these heightened risks are connected to social determinants of health, the conditions that people have to face every day of their lives. For some South Asian Americans, language barriers even make visits to the doctors more difficult. Other immigrants who are adjusting to this nation, trying to make a living, working multiple jobs, are often neglecting their personal health experience as well. That makes it all the more important that Congress step in and act to promote better understanding, awareness, and research of heart disease. Because of that reason, I am proud to lead the Senate version of the South Asian Heart Health Awareness and Research Act. For each year between 2023 and 2027, this bill would authorize additional funding and grant money to promote awareness of the increasing prevalence of heart disease in disproportionately affected communities. It authorizes the Center for Disease Control to develop culturally appropriate materials to promote health, support community groups involved in heart health promotion, and support conferences and research workshops dedicated to the issue. And finally, it establishes a central source of information on heart health to help patients access resources quickly if need be. This bill, again, is a bipartisan bill. It's a bipartisan approach. It's a bicameral approach to address a clear heart health and research gap. With the leadership of Representatives Jayapal and Wilson in the House of Representatives, this legislation has already passed one chamber of Congress twice already. It's now up to the Senate to pass this common sense bill and take a step towards addressing disproportionate impact that heart disease has on South Asian Americans. As a representative of New Jersey, one of the states with the largest South Asian communities in the country, I have the chance to interact often with constituents from Pakistan, India, Bangladesh, and other South Asian countries. They are such critical aspects of the American story, the American fabric. And I urge us all today to not let this opportunity slip by, and I now ask for unanimous consent to pass the South Asian Heart Health Awareness and Research Act. I ask unanimous consent that the HELP Committee be discharged from further consideration of H.R. 3771 and that the Senate proceed to its immediate consideration. I ask unanimous consent that the Booker Amendment, which is at the desk, be considered and agreed to, the bill as amended be considered read a third time and passed, the title amendment at the desk be considered and agreed to, and that the motion to reconsider be considered made and laid upon the table.
Is there an objection?
President.
Senator from Kentucky.
I object.
Objection is heard. Mr. President. Senator from New Jersey.
Thank you very much to the Senator from California, the presiding officer. It's good to see you there, and I wish you a very Merry Christmas. Mr. President, from 2019 to 2020, we have seen a rise in homicide rates in all corners of our nation, by 30% in urban areas and 25% in our rural areas. Much of this increase can be traced to gun violence epidemic that plagues America. But today I rise to ask my colleagues to join me in passing a bill that will address violent crime and bring perpetrators to justice at a time when our assistance is so desperately needed. Each instance of violence and each death especially is painful for family, friends, and for the loved ones of victims. Nothing can ever replace losing a loved one, but some semblance of closure can be provided to victims' families when the perpetrators of these crimes are brought to justice. It's time to do more. The data indicates that these crimes are committed repeatedly by the same individuals. Less than 1% of the population is responsible for over 60% of gun crimes in this country. A 2017 analysis of shootings in Oakland revealed that just 0.1% of the city's population was responsible for most of the homicides. Yet the homicide clearance rate, defined as the percentage of those crimes that are solved, have dramatically declined recently, falling 7% from 2019 to 2020. Currently, about half of the murders in the United States, half, are ultimately solved. For every murder and non-fatal shooting that goes unsolved, the public is put at greater danger. The pattern of dismal clearance rates in this country are disproportionately impacting minority communities. It is a tragedy that we can solve. Police need the resources to solve homicides, that crimes of gun violence nationwide. Police need the resources that the evidence demonstrates if they had, they can vastly improve their clearance rates. This past July, the House passed a bipartisan bill, the bill I introduced in June, the Violent Incident Clearance and Technological Investigation Methods Act, or the Victim Act. This bill would establish a new grant program through the Department of Justice to help state, local, and tribal law enforcement agencies improve their clearance rates for homicides and non-fatal shootings. At a time that this wrongful, erroneous language about anybody in this body wanting to defund the police, this is a chance to apply police resources, give the police more resources to ultimately solve the crimes that are most savaging and hurting our neighborhoods. This is a critical bill. It's a bipartisan bill. It's a bicameral bill. And it would provide the kind of grants that we have seen to help dramatically solve violent homicides. The Victim Act has been endorsed by the largest police groups in the country, the Fraternal Order of Police, the International Association of Chiefs of Police, the major cities' chiefs of police, and others. They are telling us they need these additional resources to help make our communities safer. It is unacceptable that we have this level of murder in our country. Communities are being shattered, and law enforcement agencies don't have the resources necessary to bring the victims and their families the justice they deserve. This is an issue that cuts to the heart of criminal justice. And so today, I ask unanimous consent that the Senate proceed to the immediate consideration of H.R. 5768, which has been received from the House and is at the desk. Further, that the bill be read a third time and passed, and the motion to reconsider be considered made and laid upon the table with no intervening debate.
Is there an objection?
Mr. President,
Senator from Kentucky.
reserving the right to object, our federal debt is now over $31 trillion with no end in sight. The legislation before us authorizes $1 billion in new spending. This bill comes just after, in the dead of night at 1:30 in the morning, the leadership of this body released a 4,000-page bill that spends $1.7 trillion and will add over $1 trillion in new debt to the country. We've learned the hard way that profligate federal spending comes at a great cost. The trillions of supposedly free money that Congress spent over the pandemic was not free at all. Inflation continues to eat away the purchasing power of every American family, regardless of income. The least fortunate among us are worse off because of our spending. The working class, those who live on fixed income, are the ones who are hurt worst by inflation. Inflation comes from spending money you don't have. This is why I offer to modify the request. We should study this issue. And before we add any dollars to it, we should study this issue further. So I've asked that the Comptroller General of the United States conduct a study of crime and crime clearance rates by jurisdiction, identify specific technological methods that improve clearance rates, and determine whether one approach yields higher clearance rates than others. This report should also discern whether efforts to defund the police have adversely impacted those rates, and explore fee-based mechanisms to pay for federal grants to reduce violent crime after the completion of this study. It's time we stop forcing one-size-fits-all policies on states and local law enforcement. Each jurisdiction is unique and deserves to implement the most appropriate practices for their constituents and community. Therefore, I encourage the passage of my amendment. So, still reserving the right to object, I ask unanimous consent that the senator modify his request to include my amendment, which would allow for this report, which is at the desk, that the amendment be considered and agreed to, the bill as amended be considered and read a third time and passed, and that the motion to reconsider be considered made and laid upon the table.
Does the senator so modify the request?
Mr. President, this might be seen as a Christmas miracle, but I am grateful for that suggestion from the senator from Kentucky. I'm disappointed that he does not accept this bill, which does not impose anything on local law enforcement, but gives them opportunities for resources that they can apply for. It is going to help us actually lower the cost for local communities, because one murder in one community causes such economic damage. You can't put a price on human life. But I do feel a sense of gratitude that the senator from Kentucky might be willing to work with me on finding a way forward, and that there is some area of common ground. So I don't accept his amendment now, but I look forward in the new year, in the next Congress, in finding a way to perhaps work together to some accord.
He
So no.